Just about 7:23 now. Welcome back to the program. Do your children constantly get up during the night, then have a tough time falling back asleep? Or maybe they seem unusually restless and irritable and have a tough time staying awake in the middle of the day? Well, these problems could be caused by a form of eczema. Dr. Robert Haber, a pediatric dermatologist with University Hospitals, is here to explain the link between this relatively common skin condition and behavioral problems. Good morning, doctor. Good to see you again.
Good morning, Lou.
This is a form of eczema. What form is it?
Well, eczema in general is a condition where the skin becomes very dry and itchy, and therefore you scratch it. Atopic dermatitis is a particular form of eczema that primarily affects children. It has a particular pattern, it's chronic, and it itches a lot, and it can begin as early as infancy.
For parents out there, what exactly does it look like? Red, blotchy skin?
Well, red skin, it becomes somewhat scaly. It can, again, itch a lot, and when you scratch the skin will thicken. So red, thickened, scaly skin, and the kids will itch a lot. Most people with eczema know it because they're going to be seen by their pediatrician or end up at a dermatologist's office and have hopefully a proper diagnosis.
All right, now what are the behavioral implications here? Scratching, obviously, it's annoying, but it goes a lot more than that, doesn't it?
Right. Well, a study was done in Pittsburgh that hypothesized that kids with bad skin who itch a lot won't sleep very well. And if they don't sleep very well, they're going to have behavior problems in the morning. And that's no surprise to any parent.
Right.
You know, if your child doesn't sleep well, they're going to be grumpy in the morning. And that's exactly what they found. But what they looked at were school-aged children who, during the day, had a lot of behavior problems. They weren't able to, again, sleep well during the night. They were irritable and unpleasant sometimes during the day. They had sometimes very significant behavior problems at school, and that has implications for learning. The whole family becomes very disrupted because if the children aren't sleeping, nobody else in the house is sleeping either.
And that's a big problem indeed. Let's take a phone call for you, doctor. This is Ken in Cleveland. Good morning, Ken.
Good morning, Lou. My son has eczema. I also had it, and I also grew out of it, I guess when I was about 14. And my son has it real bad. And I've been trying different creams and whatnot, and I want to know what the doctor would recommend.
All right, what do you do about it?
Well, it's hard to diagnose and treat on the television, obviously. But Ken, some basic principles are not over-drying the skin, so using lots of moisturizers and minimizing the amount of time that the child is in the bathtub. We can use anti-itch medicines, and in particular, I think the take-home message here is both for parents and for the doctors. For the parents, if your child has a bad skin problem and he's not sleeping well, get to your pediatrician and get some help in getting your child to sleep. The message for the doctors is, if you're taking care of a child with one of these conditions, ask about the sleep behaviors, because if there's a problem, that needs to be addressed, and proper medications and proper referral, when necessary, will really help a lot of these problems.